So there's a couple of things. We do know that younger people are very likely to have very mild illness or not recognize symptoms. So that's why we're saying anything, go get tested, particularly if you've been at one of the exposure events and people know who they are. And that's why we're seeing quite a lot of people going for testing. We did over 3,800 tests in the last 24 hours. And, a proportion of those were people who tested positive today. So that is something that we're looking at. So even very mild symptoms, and there's a whole list of them, you can go get tested. Having said that, we also found a very similar thing in elderly people, particularly our elders in long-term care, that sometimes they had very little or no symptoms at all, mostly things like fatigue, or they may have had, they may not have had a fever, for example. So we have adjusted as well to make sure that we test everybody in a care home, for example, if there's a case there. So this virus has proven to be quite stealthy that way, and that makes it a challenge for us. That's why it is so important that we reduce our potential for getting exposed in the first place. In terms of whether the virus has mutated, we haven't seen evidence of that. And a couple of times ago, we presented some of the data on the whole genome sequencing that we're doing of all of the cases in BC. And that's one way of helping us understand. And the thing about this virus that we're seeing around the world is it does change. It mutates, but relatively slowly compared to some other viruses like influenza, which change really, really quickly. So there's a couple of reasons why that's important. It means that immunity is likely to last for a longer period of time. It also means that the chances of a vaccine being effective for a longer period of time and in a broader population is slightly more likely. So that is something we watch really, really carefully. So good questions.
Do you have a follow-up question, Ashley?
Yeah, I do. Thank you. I know we've talked about this in the past, so I apologize if this is a repeat question in a way, but I recently spoke to someone who recovered from COVID. She's a bit younger, and she's still seeing mysterious kind of side effects that doctors aren't really sure if they're directly linked to COVID or from impacts of how her body had to fight it. So for the young people maybe listening to this who don't think they'll be drastically impacted by the virus per se, what do we know at this point about the long-term impacts, especially when essentially a person's immune system is how they have to fight the disease right now?
Yeah, and that's also a really good point. We do know that for some people, and we don't always know who. Some of it has to do with the way our own immune system reacts and our genetic makeup. Some people have very severe illness, and some people have long-lasting impacts, even with a milder form of the illness. So they may not have even been hospitalized. They may have had a relatively mild illness. But the things that we're hearing from young people is that fatigue, like difficulty even sitting up, profound fatigue that lasts for a long period of time. For those people who do have pneumonias, difficulty breathing, shortness of breath that can last for a long time. We also know for a subgroup of people, more likely to be men than women for reasons we don't completely understand, that they have increased clotting in their blood, and that can lead to clotting of the arteries around the heart and heart attacks, or it can lead to challenges with brain injury or with what we call pulmonary embolism, so big blood clots in the lungs that can actually happen weeks later. We've also seen in young teenagers and young adults that they can have a post-viral syndrome that can cause inflammation of the blood vessels, and it's been called a number of different things around the world. We have not seen any positive cases yet in BC that have been diagnosed, but we've been watching for it. So this is the MISC syndrome, and we have seen that around the world too. So we are learning more. And we are learning that there can be long-term impacts that can be quite severe, even for young people, and that last. We only have months to go right now, but that have lasted for many weeks and months for some people.